Hello everyone, welcome to another episode of PT Luis, and for today's video, I'm going to talk about rheumatoid arthritis. So, let's get started. Okay, so rheumatoid arthritis is the most common inflammatory type of arthritis. Aside from osteoarthritis, which is a non-inflammatory, our second most common type is your rheumatoid arthritis. So, what causes RA? Basically, it's an autoimmune disease. So, what happens is your own body attacks the own cells of the body. Thus, it produces a systematic affectation, no? So, for example, as you can see in this video, that in this hand, there are affectation of the joints of the fingers. It's because there are deformities and there are bony erosions in the joint itself on the fingers, finger joint, and on the wrist, which is why most common affected areas are hands, wrists, knees, ankle, and feet, no? So, now, when we try to compare RA versus OA is more localized. Osteoarthritis is more localized in a sense that it can just affect one joint of your body. It could be just the right or the left. Whereas, when we talk about rheumatoid arthritis, since it is systemic, it can also affect symmetrically. So, meaning it can affect both your hands, both your knees, both your ankle and feet, no? And also, it could affect the small joints of your body. So, as we can see in this hand, there are different deformities because most of the joints of the hands are affected already. Okay, so what are the symptoms of rheumatoid arthritis? No, so we have listed 6 here, but I just want to take note that it could be a confounding factors or symptoms, or they could appear multiple times for a different patient. No? So it depends on the severity of the condition. But number one, since we're talking about arthritis, is of course joint swelling, which is combined with joint pain. No? So usually, patients with rheumatoid arthritis would feel this joint pain and swelling for at least 6 weeks. Another one is patients would also feel joint swelling and stiffness. So it's a combination that is usually experienced in the morning, no? So when they wake up, they would feel swelling and then stiffness. They would have difficulty in moving, and it would last for at least 30 minutes, no? So, and because of that pain, swelling, and stiffness, sometimes it leads to feeling of tiredness or fatigue. So, because systematically it affects a lot of joints in their body, so they would feel tired, and because of that, it would generally lead to feeling unwell, no? So that's why we don't want the patients to have a progressive experience of the symptoms, because when they feel unwell, of course, they would have reduced ability to perform their physical function or physical activities or activities of daily living. That's why you want to try to minimize, no, the progression of the disease and control and manage it even if there are present symptoms in there. Here's the difference between OA or osteoarthritis and rheumatoid arthritis, because when it comes to rheumatoid arthritis, symptoms can vary from day to day. What does it mean? So they could feel better and good one day, and then the next day they would feel extreme pain or extreme stiffness and difficulty in performing motions or actions. It's because they're experiencing flares, or what we call your attacks, or also known as your acute exacerbation of symptoms, no? This is like unpredicted attack of symptoms that just being presented to the patient with rheumatoid arthritis. But this is also the thing that could discourage the patient in actually performing their physical activity. That's why I want to take note on this, that although patients with rheumatoid arthritis are feeling these flares or acute attacks, we can still try to perform alternative exercises or interventions for them to still continue in performing physical activity. Why do we want them to perform the physical activity? It's because people with rheumatoid arthritis can have an increased risk for CVT. So what happens? It's written here. So because of the symptoms that they are feeling, like the pain, the swelling, the stiffness, and feeling of tiredness, they would have increased physical inactivity and a sedentary behavior. Thus, they won't be able to function well and they won't be able to perform their activities of daily living. And because of that, they would have an increased risk for coronary artery disease and developing heart failure. But of course, as physical therapists, we don't want that to happen for our patients. So what we want is to promote a healthier lifestyle by performing regular physical activity. I want to explain further that performing physical activity is not just to address the risk for cardiovascular diseases, because it can also, of course, improve the overall fitness of the patient, thus reducing the risk for example, developing diabetes mellitus or hypertension or cerebrovascular diseases or stroke. And since you are performing physical activity or exercises, it can also help you minimize the pain and then the fatigue that the patient is feeling, and also prevent the muscle loss, the bone density loss, and other factors that could lead or could affect rheumatoid arthritis. Okay, so what are these exercises? Number one, we have your aerobic exercises. And the most basic one is just walking. Or if you have an available pool, then you can do swimming. You can do jogging. You can do cycling. So those are the most basic aerobic exercises that keeps your heart rate slightly elevated, no? The next one is muscle strengthening exercises. Now, we want to perform strengthening exercises again to prevent the comorbidities brought about by the rheumatoid arthritis. And of course, you want to maintain the strength and joint integrity of the patient. Okay, so the third one is perform flexibility and mobility exercises. So what are these things? So even just basic range of motion exercises will do. And why do we want to perform it? Because remember, patients with RA have joint stiffness, and moving the joint actually adds a little lubrication, which minimizes or controls the pain of your patient. Okay? And then balance exercises. Why? Because there's a tendency that because of your physical inactivity or sedentary lifestyle, so you'll have difficulty in performing functional activities, no? So of course you want to maintain and improve the balance of the patient. So here's the problem. What if there are flares or attacks from the symptoms of rheumatoid arthritis? How can the patient perform the physical activity? What we want to explain or what we want to share with our patient is this one. Even if you can only manage 10 minutes at a time, it is still important to start somewhere. Of course, we cannot take away the fact that the patients are feeling the flares or the pain and the other symptoms of rheumatoid arthritis. But it is still better to be more active than be physically inactive, because I have already mentioned the different risk factors that could happen. So this is actually where a physical therapist can takes its role. Okay, because as physical therapists, we can help by gradually assessing and managing your condition and giving you alternatives and gradual progression of exercises so that you can still perform your physical activity safely and effectively, even if you're feeling those flares or attacks. So I hope you can still be pumped up and you can still be interested in performing exercises, because it will really be helpful in managing your condition. Alright, so that's it for me today. Thank you for watching. I hope you find something meaningful in this video. If you're interested for more, go check out those other videos. And I'll see you on the next one. Bye!